All right, we're going to go ahead and get started. Thank you all for joining us today. We are hosting the PDGB5 April webinar, which is focusing on developing programmatic use cases. We're thrilled to be joined by two states who are going to share their example, as well as Howard Morrison, who's going to be sharing the national perspective on how use cases have been developed to support better using data to inform decision-making in early childhood. So thank you all for joining. Today, we're going to be focusing on a couple different objectives. And so I appreciate you spending some time with us. We're going to focus first on learning the concepts of a programmatic use case. We know that historically, there's a lot of technical use cases that are usually used for requirements gathering. And what we've learned from doing this for a long time is that this programmatic use case idea is really helping states to hone in on the specific areas of focus and what the early childhood data can be used to support and inform. It's helping to phase out the work. And Howard's going to be talking more about the benefits of using this in just a few minutes. We're also going to be using this webinar to help increase the knowledge and skills of developing a use case. You're going to hear a couple different approaches from our states today that can support the use of the data for the larger integration efforts in a state. And then finally, we're hoping that we're going to be able to have an opportunity to build the understanding of how these two states have approached their programmatic use case, both give you the different ideas of how to go about it, but also the outcomes that have come from that. They're in two different stages, and so it's an opportunity to learn from a state that's earlier in the use case development and from a state that's further down the road and has used a use case to actually develop out their first analytic tool. So we're excited to have everybody here today. The agenda is set up so that I will very quickly walk through these overviews, but Howard is actually going to be the person who's going to talk more about the benefits of using a programmatic use case today. He's going to review that. What are the different components? What is a use case? What does it look like? And why do we have them? And then thinking about how states have approached this, and he's also going to present some of those different options. Then we're really fortunate to have both the state of California and Utah representatives from both states actually share their experience in doing this work and in creating the use case, and again, the approaches that they took in the development process. And we'll wrap up with some questions and resources. And so feel free, we'll be monitoring the chat. And so if you have any questions as we go forward, please feel free to type them in, and we're happy to answer them at the end of today's webinar. So with that, I'm going to very quickly introduce my colleague, Howard Morrison, who's been doing this work with me for a long time, and excited to have him present his experience. Howard is a technical assistance specialist with SRI International. He's both on PDG and has been supporting EC DataWorks. He has a focus on data integration and use. He specializes in interagency data integration efforts, which includes data governance, data quality, data sharing agreements, and stakeholder engagement to identify the key elements of programmatic information and collaboration. I was fortunate to work with Howard when he had the role that many of you have right now in the state of Texas, where he actually developed the use case and had been a co-author with him on the brief that he's going to present. So I'm happy to pass it over to Howard. Thank you for doing this today, Howard.
Great, thanks so much, Missy. Before I get started with talking about what is a programmatic use case, I just wanted to start with a few poll questions to get a sense of where everyone is, all the participants are on this topic. So the first question is, how familiar are you with a programmatic use case? Not familiar, somewhat familiar, very familiar, and then how has your state ever developed a programmatic use case? Yes, no, or I'm not sure. So I'm going to launch that poll. And we'll give just a few, good minute to let folks respond, and then I will share those results here momentarily. Okay, we're getting about 50% that's completed. We'll wait a little bit longer. Okay, I will share those results. So it looks like we've got about 50% that are somewhat familiar, 29% that are not familiar at all. 14% that are very familiar. So, and then the number of respondents for states that have developed a programmatic use case. We've got about 64% that have answered the yes, and then 36% no. No responses for not at all familiar. So great, super. Okay. So let's start by defining what a programmatic use case is. A programmatic use case describes the information needs in response to state early childhood priorities. So at a high level, this includes refining specific key programmatic policy questions, defining the purpose for integrating data, and informing the planning for the integration of data elements from contributing programs. So I'll talk more specifically about the components of a use case a little later in this presentation. So programmatic use cases should also reflect your stakeholders' information needs and specific uses. Programmatic use cases have the ability to address emerging unmet state-specific needs so users can make data-informed decisions that support their quality improvement efforts. So for states that have plans or are planning to implement an early childhood integrated data system, a programmatic use case can be a great first step to initiate that process and move toward integrating cross-agency data. There are many benefits to having a programmatic use case. Having one helps you or your team discuss the key information with agency leadership and community stakeholders about the critical elements required, as well as show tangible actions to demonstrate the benefits to the state and identified primary users. So let's talk about some of the benefits and what that might look like in actual practice. So articulation and documentation of the information needs of the intended users. So here you might have identified the key programmatic policy question as, are children birth to age 5 on track to succeed when they enter school? And have identified childcare directors as the intended users. Alignment of policy questions with decisions and actions. This is ultimately ensuring there is alignment from the policy questions to the state goals and priorities. Early identification of access and functionality. This allows you to communicate the level of access of your data and how you want to see it visualized. For example, you are going to need data at the state level, and the data will be visualized in a chart or graph. Prioritization of data elements. An example here is that you have identified that you're going to need data from X data systems and will need A, B, and C data elements. Communication of the outcomes to leadership. A programmatic use case provides a shareable resource that succinctly shows what you are trying to accomplish, the actions to be taken, and the alignment to the state's goals and priorities. And then lastly, engagement with the technical design team. The use case gives you a clear, concise document to begin conversations with your technical team so they know the data systems and the data elements that will be needed in the actual analytic tool for that development process. So let's talk about the use case development process. When designing analytic tools, it's important to engage stakeholders in the process. Ultimately, they are the ones using the analytic tool, so it must meet their needs or it will not be used. The process of developing programmatic use cases can help ground the conversations with stakeholders, agency leaderships, and data teams. So when engaging stakeholders, it's important to create strategic goals for engagement, differentiate general learning versus required learning, and create feedback opportunities that align to stakeholders' goals. So for more information on engaging stakeholders, EC DataWorks created a blog and podcast on maximizing appropriate involvement for ECIDS, and that's available at ecdwcommunity.org. So let's talk through the 6 steps used to designing programmatic use case. In the first step, we've got develop a list of state early childhood policy priorities. Here, you are identifying the various priorities. For example, your state is focused on ensuring all children enter school ready to learn. Next, you'd validate with leadership and governance bodies. So early leadership buy-in is critical to the success and sustainability of the use case and soon-to-be analytic tool. Next, you'd align the research agenda or list of questions to policy priorities. So there may be multiple programmatic policy questions that fall under a specific policy priority. In the example of ensuring all children enter school ready to learn, multiple questions will align to this priority. And I'll talk about this a little bit later when we get to the use case example in the presentation. Next, you create topic areas for potential programmatic use cases based on similar sets of questions or research priorities. So you may have multiple questions that are going to align to topics such as access or quality or early childhood workforce or school readiness, and so on. Then you prioritize the topical areas to really help focus the programmatic use case. So here you're identifying which use case is of the highest need and highest impact. This may be determined by your stakeholders in collaboration with your data leadership team. And lastly, develop one or more programmatic use cases. Here, you're completing the sections and components of the use case, which I will talk about in the next section. So based on what we've learned from working with states over the years, a programmatic use case includes 2 sections to differentiate the process. Section 1, information needs, and section 2, analytic design. So gathering the information needs is the first step and must happen early in the process. Then you may transition to the next step in phase 2, the analytic design. Let's talk about the components of the information needs section. The topical background information provides valuable state and or national context for the programmatic use case. So when writing and thinking about the background, really focus on why this topic is important to your state. So an example here could include developmental child outcomes or school readiness. A clear and focused statement of the goal will help those developing a programmatic use case to align it with state priorities and improve its relevance for the program or policy decision makers. States are often presented with multiple policy questions from policymakers, advocates, educators, and stakeholders at large. So part of the programmatic use case development process engages stakeholders to identify the key policy questions that address the identified need and to prioritize the policy question for each specific use case. And remember, the key policy questions should align to the state strategic plan and or priorities. So clearly defining the user allows the programmatic use case developers to prioritize the information needs of the primary audience. The programmatic use case developers may also identify secondary users and tertiary users or beneficiaries of this information. The expected actions provide the decision to the audience and user for the next steps once that data is available, and then how can they use it? So this communicates how the data will be used to improve programs. For example, to facilitate strong decision-making on professional development, potential collaboration strategies, or even resource allocations. The impact section should identify who will be impacted and what action will be taken, and should answer the question, how will this action impact children and families in our state? It's important to identify the impact of the programmatic use case. So often a use case may pertain to more than one audience, and it is important to recognize that applicability. So once you've identified that applicability to other users to demonstrate the impact. For example, this applies to local program administrators, but could also apply to state level policymakers. Now that we've reviewed the information needs, let's discuss the analytic design components. So having a clearly defined set of data elements allows the technical design team to ensure the best available information will be integrated. The programmatic use case includes the required data elements, the data sets, the data systems that are needed, potential definitions, and option sets for the analytic tool to display the information. Identify the frequency of the data being updated is important for program area staff and the technical design team. The program area staff generally will know when data collections open and close. The technical design team will need to know their level of effort in making changes or updating the reports. So the programmatic use case identifies how often the data are refreshed, determine if this is done annually, twice a year, quarterly, or another identified recurring period of time. It's also important to identify the access level of the programmatic use case. This helps the technical design team know which level to display and how they need to aggregate the information. This is also helpful to communicate to the audience and user so they know which reports are applicable to them. The use case identifies the access level to provide clarification on whether the data will be available at the state, regional, local education agency, county, zip code, school, or even classroom level. Providing the functionality of the programmatic use case is a critical piece to convey the different components required for the data visualization. This will help when having conversations with the technical design team to determine what functionality needs to be offered. The functionality of the use case includes preferences for data visualization, such as filters, search functions, necessary links, graphs, or charts. So when completing the information for the programmatic use case, the team leading the use case development starts with a key policy question, goal, and background information. The other components do not necessarily have a specific order of completion. The programmatic use case is used as a communication tool with agency leadership, data governance bodies, and stakeholders. States often create multiple use cases based on stakeholders' needs. State program staff may utilize the use case in policy memos to convey the information needed to prioritize the use cases with the governance body and to share with key components in the proposed analytic tool with their stakeholders. Each group can use the programmatic use case. So let's discuss a few examples of how agency leadership, data governance bodies, and stakeholders can use the use case. So for agency leadership, they can communicate the outcomes to executive leaders to align with state priorities and demonstrate how the policy question aligns with the state strategic plan or goals. For data governance bodies, they're able to identify the information needs for access and functionality early and the actions that will be taken from it. They'll also be able to prepare the program area team to engage with the technical design team and then prioritize the data elements that are needed across data systems. And then for stakeholders, they're able to communicate the identified information needs and components of the programmatic use case. So let's review an example of the programmatic use case. Here, in this example, you see there's been identified a use case title of school readiness, identify the background in regards to ensuring all children enter school ready to learn. The state priority has been identified as schools and programs and families with greater insight into specific strengths and needs of the incoming kindergarten cohort and professional development supports. And then you'll also see the multiple policy questions that align to the state priority and goal. So such as, are children entering school ready? Or are schools ready to meet the needs of the incoming kindergarten cohort? Here, you'll see the primary users have been identified as district early learning director, or K through third grade district principals, or K through third grade district community partners. And the actions expected. So here, some of those actions would be determining appropriate professional development opportunities for educators, staff to meet the needs of the incoming kindergarten cohort. And then also clarifying the impact. So how is this impacting other potential secondary or tertiary users? So state and community leaders are able to make decisions around allocation and provisions of training. It also is going to allow district and community-based providers to work together to provide shared professional development and training. And then the last section for the analytic design, you'll see the functionalities been identified as filtering by state, region, and district. You'll also see the access level being identified at the state all the way down to the school level. The frequency updated annually, but if the data is available, quarterly would be best. And then the data sets that are going to be required. So program types, so that could be childcare, Head Start, public pre-K. Child attributes, including race and ethnicity, program curriculum, end of year pre-K data, beginning of year kindergarten data. So just an example of what a school readiness use case could potentially look like and be utilized for a state. Now that we've discussed what a use case is, the components, how to use it, and reviewed an example, let's hear from two states' perspectives. We'll start with a panel from California to hear about their recent use case prioritization process. So today we are joined by Deanne Wharton, Deputy Information Officer at the California Health and Human Services Agency, and Lupe Jaime Milam, Deputy Director of Child Care and Development Division at the California Department of Social Services. Thanks for joining us today.
Pleasure.
Right. Okay. So Lupe, I think I'd like to start with you and ask if you're able to share where California is in the development of an integrated data system.
Thank you, Howard. And again, appreciate being here with everyone and appreciate the opportunity. Let me provide some background in regards to California to kind of provide a little bit of the landscape. So as of July 1st of 2021, under the Early Childhood Development Act, this transferred the child care and development programs from the California Department of Education to the California Department of Social Services. And so we'll reference as CDSS. This then brought opportunities to leverage the PDG P5 funding and begin the integrated data system under the Brilliant Beginning initiatives in an effort to modernize and have technology and data supports for the child care and development system that just transferred over. California's information and data is necessary for the administration of child care programs that are currently being spread across different intermediaries across the field. And so because of that, it creates a bit of a challenge in regards to the ability to be able to look at informed decisions and also data-driven policy making without having the proper data to lift up these areas. So with the Brilliant Beginnings work that came with right after the transfer, it intended to mesh seamlessly with connecting childcare systems, efforts at CDSS and other state agencies, locals, including our Cal Health and Human Service agencies for the work that we're doing around the ESIPs. Another component of the Brilliant Beginning is also the Cal Sparks that came with the transition as a way of being able to support and upgrade some of these legacy systems. Cal Sparks stands for California Supporting Providers and Reaching Kids. And it intends to modernize 3 critical points of childcare services. One is the administration of the programs themselves, the process which childcare providers serves a family and a child, and how families search for providers, subsidies, and educational materials. And so with this said, CDSS also participated in the use case development for the Early Childhood Integrated Data System, which is ESIPS, with the California Health and Human Services Agency. Cases are being developed during a 90-day sprint, and it was pretty fast. And once developed, these cases will inform our data elements that we need to have as a critical piece. The ability of CDSS data infrastructure supporting Brilliant Beginnings, the enterprise data pipeline to submit data to Cal HSS infrastructure to support ESIFs, and the agency data exchange was all confirmed success. This represents a significant step in our initiative in supporting data into the ESIPs, which is our major goal here. So it all tied nicely together in regards to all this work that we're doing around our data landscape.
Great, thanks, Lupe. Could you share a little bit just quickly, how does it align to the California master plan that you all have developed?
Yeah, so the California Master Plan for Early Learning and Care has some recommendations that are organized under 4 overarching goals. And these goals are under quality, opportunity, and affordability for the California early childhood system. And so with this then, we dived into having these different pieces where it provides almost like a roadmap in a sense of how to focus through these different initiatives. Bright Beginnings, as I mentioned, Brilliant Beginnings, as well as the Cal Sparks areas were important of that to ensure that we're doing it. But also most importantly was the master plan provided just a long list of pieces through stakeholder feedback of what we wanted to achieve. And the use of the use case rapid meetings allowed us to dive into each of these areas, unpack what we have available, what we don't have, what we're solving for, but most importantly, prioritize these long-term goals in the master plan. And the experience for assist us on mapping these out.
Great. So I'd love to kind of dive into how did you know it was the right time for California to engage in the use case prioritization process?
Yeah, so several things aligned with us, right? One was the effort of current data landscapes, building on a couple of statute AB 2621 and AB 2960, which were both created to ensure transparency of information for parents and families to have timely information to make choices about their childcare services. Then, like we referenced, the transfer of the Early Childhood Development Act of 2020 and the master plan that laid all the groundwork for this opportunities for data modernization. And then CDS has this new responsibility as the state main administrator of these childcare and development services, really has defined a pathway of how to have these comprehensive and accessible data, right, to ensure that there's intersector alignment and guiding policies where we're targeted in our resources. So all that tied together works with the Brilliant Beginnings and the Cal Sparks, are key ingredients into the right time for California, where our stars align for this process.
Right. And, what did you have in place to do this well as a team across agencies to really support going into this work?
Howard, I have to smile at the word "well," because when we went through the experience, you really have to wonder, can California end with some top priorities, right? Going through a use case rapid fire meetings. And I think that the well was measured by that we did. And I think those key pieces, again, like mentioning not only the master plan but one of the pieces that I also want to call out was the partnerships and having key partners at the table that's not in a silo of CDSS working at this alone, but also having our California Department of Education partners, for example, Health and Human Services, and then of course, with our next steps are also our stakeholders and so much other pieces that are involved with this. So I think that those are key pieces for this too.
Yeah, I think that's a great point. I think if you look at all the state leaders that were engaged in the use case prioritization process really kind of helped shape that work, right? From leaders from within the agency, across programs within the mixed delivery system.
Yeah, completely agree with you on that too. It really was core and foundational.
So let's shift a little bit and talk about why was the programmatic use case prioritization process valuable and how did it help?
Yeah, so for us, it was valuable because it had a significance where we were creating a project or a product that would support the field. It was identifying potential use cases for data integrations that help us understand who our users were, what they do, what type of data they may want to create, and how would that interact with the greater system, right? With the childcare and development system as complex as it is in California, and the value of our mixed delivery system being implemented across multiple state agencies at multiple levels, developing a use case based on a system that will support children from birth to age 5 and beyond, their families too, and the early learning and childcare providers that supported is not an easy task. And so we know that this was quite valuable because of all these reasons. This process did help us ensure that a system can be comprehensive, ethically designed, while also organizing and identifying the priority of development and implementation. And I think Deanna might want to add some further experience to this too, Howard.
Great, thanks, Lupe. Yes, I did want to cue Diane and I was muted, so I fixed that.
No worries. Thank you so much, Lupe, for sharing that. First of all of the things that Howard was talking about around the analytic design components starts with a clear understanding of that use case. So as a technologist and a technology team, it was really essential for us to be part and to participate in these sessions to get that early look at where Department of Social Services and other state leaders were leaning towards. And as if Lupe hasn't shared enough about all the different changes in California with the CDE transfer of programmatic responsibility, the development of DSS's infrastructure, and the development of many transactional systems that will be supporting DSS across the board and will be feeding data into Brilliant Beginnings and then into eSIDS. Our agency also views eSIDS as a component of our whole child program. So we're very focused right now on looking at the whole child and addressing their multiple services and service needs. And certainly eSIDS is answering some of the same questions we want to be able to answer. We are building out that agency data exchange. So Social Services has its pipeline and its repository and analytics environment. Agency also has one that it's developing to capture not just the eSIDS and Social Services data sets, but healthcare data sets across the board, right? Our public health, our Department of Healthcare Services, et cetera. So we just needed to be there to hear what they were going to need down the road. Not all data will come out of Social Services, and we need to make sure we can support the effort through other agency departments as well.
Great, thanks, Dan. So let's shift to, what was the outcome of going through the programmatic use case prioritization process? And so maybe we'll shift to Lupe to kick us off on that one.
Thank you, Howard. One of the pieces, as we were working with stakeholders in California, we heard something that was very critical and really touched us on this too. We had heard nothing for you without you, meaning that it really does take all of us together to be able to make sure that this is successful, including all the voices from our stakeholders. And so as we, as the state levels and can design a beautiful system, but if users aren't available to have access to the system and does not have a voice in the system, it doesn't improve efficiencies to provide this, then we really haven't done our job. By creating a set of use cases, as we get further down the road in our development and our decision making, we'll be able to refer back to ensure that we are truly staying true to the needs and priorities of those that we are creating the system for. So likewise, by investing time in a thoughtful use case process, the data created will better inform and really promote most equitable data-driven policies, practices, and resources allocations, which are quite important.
Great, thanks, Lupe. And I'll also ask Deanne the same question, but also thinking about how this will help prepare for the technical design.
Sure, absolutely. I mean, it's all about that at this point, right? Understanding those data elements, and you get some of that from the use case itself, but you also need to dig deeper, and that's where we'll engage data scientists and others to really explore the additional nuance that California is looking to apply to this use case, and to really understand the data that needs to be there. It will be challenging for us because, as I said, we have some systems that are under development. So we may find that some of the data that we thought we might have won't quite be ready, or we might not have the same access that we hoped for. Understanding this really early and moving into that next step in terms of the design is critical. We may need to flag some things that we need to prioritize or delay or look for other source system data for. So it's all a very key piece of our next step.
Great, thanks, Deanne. And that leads me to my last question for you all is, what are your next steps and thinking about the next phase of work for California?
Yeah, so we'll continue to roll up our sleeves like we have. We have done a lot of groundwork that we have done already. And as we go through the use case process, we will be able to prioritize the needs derived by this process, make decisions for implementation to support California, and align with the goals for the California Master Plan for Early Learning and Care, as well as the Preschool Development Grant, which is more importantly. And then we're also just concurrently expanding just our data landscape and really diving into those areas that we've identified with the use case, like Deanne had shared, to make sure that if we don't have this concurrent work available, we will be also looking for other proxies and other opportunities to continue to support this work.
And I would just add that from our perspective, it's time to resource up on the IT side and the data side, and make sure our pipelines are working and make sure our analytical tools are in place so that we can generate those insights when the time comes. So.
Great. Thank you both so much. So thank you, Deanne. Thank you, Lupe, for sharing your experience in California. We greatly appreciate you joining us today and sharing your experience. So thank you so much.
Thank you, Howard.
Now we're going to hear from Stephen Matherly, eSave's project coordinator from the Utah Department of Health. Steve has been through the use case development process and created the community assessment tool. So I'll turn it over to Steve and let him share his experience.
Thanks, Howard. I want to say right away, thank you to Lupe and Deanne in California for sharing that experience. Utah is also in the process of merging our Department of Health and our Department of Human Services. So that was very valuable information. And although we have some data products and some data prototypes, by no means are we done. I don't know if you're ever done with these kind of projects, but that was very insightful and helpful as we kind of go into the next chapter, of our journey with regards to data integration and use cases. When our early childhood integrated data system, which we call eKids, was in its earliest stages of development, one of the use cases that we shared with our community stakeholders was that it would help our eKids would help our stakeholders to develop their community needs assessment, or sometimes even a statewide needs assessment, apply for grants, complete federal reporting, things of that nature. And as most of you know on the phone, an eKids is designed to get a distinct count of children that are served across programs. So as we marketed and promoted the various uses of an eKids, our reports began to come out, first draft reports, mock reports, and then live reports. And our stakeholders looked at those reports and were like, hey, this is great. I've been able to discover a distinct count of children that are being served across programs. It's wonderful, but you said this would help us with our community needs assessment or a statewide needs assessment. We're going to need more. We're going to need much more. Go ahead. Next slide. So although that's very valuable data, a distinct count of children served across programs, well, we need it at a community level. Our eKids has zip code level data, but we need to know how many how many young children are in that community, right? How many of those children might be eligible for services, eligible through income or other risk factors. What about overall need for services? How many two-parent or single-parent working households do you have in a given community? And just how many services are available to families within that community to access, if they need it. So we got all this feedback as we're developing our eKids. Hey, we're going to need a lot more than eKids. We're going to need this contextual demographic data. Next slide. So we went about building a Tableau-based product that's kind of above and beyond our eKids, and we also have ASQ reports. This is a little bit different. This gets at the population through vital records data as well as statistics type data. This happens to be Salt Lake County and the various age breakdowns. So how many children are in a community? What about risk factors at birth? Mom's education level, or you could toggle to age. What about children born to women not receiving prenatal care, or low birth weights, or preterm births? And then, of course, your various levels of income and poverty are very critical to know. Next slide. And then, as I mentioned earlier, the overall need for services. How many single parent households and that parents working, or two-parent households and both parents are working? So a need for childcare, right? Who's watching the children during the day? And of course, race and ethnicity data. Next slide. How many services are available throughout the state? As we've mapped there, we categorize the services that are available in the state, and we categorize them. Next slide. And then, various categories: early learning, or to help with economic stability, or family support and safety, or health and development. And we also have additional data as to childcare slots and vacancies and capacity. All right, next slide. So, I believe this gave our stakeholders a lot of confidence. They saw that the use cases that they're suggesting were taken seriously and then developed into a tangible product. And I think that also opened the door to begin to discuss additional use cases that are needed. For example, not only is our eKids designed to get a distinct count of children served across programs, but we want to match this data with the state's longitudinal data system, so we can discover the impact that early childhood services have had on kindergarten readiness and K-3 success and beyond. So next slide. Our stakeholders said, well, Steve, our eKids, it only has enrollment and exit data, right? Correct. Well, if we're ever going to really engage in outcome and impact research, you're going to need more than enrollment and exit data. You're going to need frequency and dosage data. Not just was a child enrolled or a family enrolled, but at what level did they engage in the services? That's the kind of data that we're going to need to engage in meaningful longitudinal impact research. So we began to develop an additional eKids report, frequency dosage report. Next slide. Those are still in development, but this is a graphic that definitely shows what happened when COVID hit, and it's very pretty obvious. You don't have to look at a lot of stats to see what happened there around April 2020. But so next slide. So as I'm trying to emphasize, if your stakeholders are at the table, and if they feel confident that you're listening, well, then they're going to keep bringing the suggestions. And you're really never done with a project like this. It's always evolving and always growing. So even with our community assessment tool, which I talked about a couple minutes ago, it's like, Steve, the community assessment tool is great, but we really need smaller areas. County's too big. We need small areas. And we shouldn't have to pull at 1 year at a time, next year to discover trend lines, right? We want to see trends, small communities, and we need a lot more data. What about infants breastfed? What about maternal access to healthcare, child access to healthcare, to a medical home? What about children with special healthcare needs? Do they have access to the services they need? Child maltreatment rates, developmental screening rates, food insufficiently, a child homelessness, or children being read to 3 or 4 times a day. And what about referral data, referrals given and referrals received, triage data, which has led to an entirely different discussion about the state's need to develop a coordinated intake and referral system. And it all started with discussions about use cases and meeting those needs. Next slide. So just to wind up here, there's a lot of ingredients out there, right? A lot of data elements, hundreds, thousands of data elements, especially when you look at maternal and child health. At some point, as California explained, you have to decide, all right, what do we want to make? What do we want to consume? Which of these data systems, which of these data elements do we need to answer the questions? What are our questions? What do we want to learn? And how are you going to plate it? What are the bells and whistles, right? The filters, the time frames, the geography. You need to decide these things. How are you going to serve it? All right, public, private, website, sharing reports, public access, private, access, all of the above. Who's going to consume it? Community stakeholders, statewide stakeholders, federal reporting, probably all of the above, right? How does it taste? Is it so good they'll come back for more? Is it so good that they will help, pay for it? Over time, when maybe some of this federal funding, runs out, is the data products that you've developed and deployed and delivered to your stakeholders, is it so meaningful to them that they're utilizing it and then they're willing to help support it, and then even in time to help fund it? And so that's been some of our successes in Utah and some of the things that we're still working on going forward.
Great. Thanks so much, Steve. I do want to allow some time for folks to ask questions here if they have questions for Steve or Deanne and Lupe. Steve, I just want to also kind of chime in on, a few things you said. One of the things you mentioned is about stakeholders feeling comfortable and having that relationship with them that's been built over a period of time to provide feedback on the reports and analytic tools that you all have developed, and talk about ways to improve that. So you're continuously improving your data system and your data report. So I think that was really, really a key piece there that you talked about.
Yeah, it's been critical. It's been foundational. For example, our initial stand reports show a lot of our data for children under 6. Well, our stakeholders, well, that's great, but I need under 3. Or I need just 1 or 0 to 3, this kind of thing. And hey, where is that child level race ethnicity data, not just from American Community Survey, but real, head count type of data. So we're constantly have new reports in the queue that we're working on because of that feedback. And the feedback's all about the use case. These are the folks that are using the reports and they're telling you, hey, we'd like to utilize them and they're great, but we need more, or we need additional features or additional data elements.
Right. Well, and it sounds like, the initial kind of use case for the community assessment tool set that foundation. and has really helped think about adding additional either data elements or data systems to the community assessment tool. So it's really kind of leveraged some of the work that you've already done to then be able to expand upon that.
Yeah, I didn't even mention our ages and stages questionnaire reports. That has been a great need from our community and for our state. We have several developmental screening initiatives that we're currently doing, as well as planning for the future. So it's amazing. Once you have all this data integrated, what you can do with it is truly amazing. And that's been another use case that's come from our stakeholders, as the development of ASQ reports that also get a distinct count of children screened across program, by zip code and above, and monitoring below. And now we're working on, okay, which domains are children scoring above, below, monitoring, and what about scores within those domains over time? So it just keeps on going. That's one lessons learned. It's never ever done. It's like an onion. You could just keep going. But you got to start somewhere.
Right. Absolutely. Well, you kind of cued me to my other question for you, was about lessons learned or any tips to other data leads that are embarking on this process. We have a number of states that are either in the process of, prioritizing designing use cases, or thinking about developing use cases as kind of their next phase of work. So any kind of tips or lessons learned for them that you'd want to share based on your years of wisdom and knowledge in your work?
Well, it would allude to, California hit on this as well, and I just mentioned it. Of course, you need tangible products and systems that people can access and utilize. But at the same time, you have to be flexible. You have to be nimble. There's going to be changes, right? And even as soon as you launch something, the way technology is, it's almost outdated. And then, the way governments can change, leaderships can change, program leaders can change. And as people come and go, you're going to have different perspectives and different needs. And you have to be able to be flexible and adjust to that, whether it's like a new governor or a new home visiting program manager, all the way, from the top all the way to the boots on the ground program level. And you have to be able to hear all those voices and adjust to them.
Great. Thank you, Steve. We had a question that came in. And so maybe if both states can briefly respond to this. So who are the core people leading the use case, and who is accountable for ultimately driving the work forward?
I'll start from California.
Great, thank you.
Sorry. In our case, we're very fortunate. We have an undersecretary who's dedicated to early childhood. And Chris Perry, who couldn't be here today, is responsible for overseeing the overall ACIDS effort in for ensuring that the use case gets developed in accordance with what our state leaders want. But ultimately, she's leading the activity.
When our eKids started, I would say, as I mentioned, it was the program folks in the communities, our local Head Starts, our local home visiting, our local early intervention, IDA Part C, what they needed, for their reporting and for their community needs assessment. However, over the years, Utah has evolved that we now have an early childhood governors commission, and we now have a PDG strategic plan. And we're very much, we've always been focused on systems work, but I'd say that focus is increased and heightened now more than ever. So now we have another group of stakeholders that are really focused on improving the system here in Utah, like I said, at a governor's commission level or agency and department, executive director level. So the whole bit now from the program level, all the way up has what we've seen evolve over the years with our early childhood integrated data system.
Great. And just maybe 30 seconds from each state on how is the IT portion of the work funded? So what funding sources are you leveraging to either move this work forward in development? So maybe California, maybe Lupe or Deanne, do you want to just briefly share?
I can speak to that a little bit. First of all, we are leveraging PDG funds, and we're so grateful for those and for the way that they've supported not just the programmatic side, but also supporting our data analysis and other activities directly related to ESIDS. We are fortunate that we have a lot of organizations interested in the work that we're doing, and we have been able to get some grant funds, and we're also requesting some general funds to do this work as we move to the technical portion.
In Utah, primarily over the years, it's been our Early Childhood Comprehensive Systems grant, but also our matching database, which is critical, foundational to our eKids. Well, that was supported by a Medicaid implementation advanced planning grant, and we've received some other funds over the years. However, Utah is not an ongoing PDG state, and we hope that that gets released and that we're able to harness that in the future. And we would love to get state funds directly contributing to our integrated data in the future. And as I mentioned, our Health and Human Services is consolidating, merging, and they're looking at a broader, bigger data warehouse. And of course, the state funds would contribute to that.
Right. Quickly want to ask the California team, so either Lupe or Deanne, just give a quick high level kind of response on how many use cases did you have when you started the prioritization process versus how many that you're going to complete or revisit to actually complete and potentially implement.
Deanna, do you remember how many? It was a laundry list. Can't remember exactly how many, but we ended up with 3.
But those are just the first 3. We will have many more by the time we're done. We need to prioritize our work right now to get some things done in the first year or so. So off we go with those.
Great. Thank you both. And then just briefly, maybe within the last minute, describe how are you using some of the use case to manage users' expectations. So thinking, maybe Steve, start with you, just thinking about how you use the use case to manage expectations, thinking about here are the specific uses, the specific actions, and how that might have helped.
Well, it helped to be able to articulate your first steps, right? So as I mentioned a couple of times in this presentation, you have to start somewhere. And of course, we want it all. We want it all right away. But what can we do first? Well, we have to get to that distinct count of children served, because once you have that data, then you can really build upon that. And so that, I would say that's how we managed expectations. And then it was like, as I've described, okay, now that we can do that, what else can we do with this data? And we're still working at taking this data and matching it with our state's longitudinal data system. So Utah's still, learning and growing, and we're still in this process with you.
Yeah. All right. So we are about out of time. So I'm going to wrap it up. Move to the next slide in 1 second.
Yeah, and I'll wrap it up for us. There's a couple resources. We've tried to add them along the way into the chat box. So hopefully those are resources that will be helpful for you all who are considering this process. I want to thank our presenters today. Thank you, Deanna, Lupe, and Stephen for being part of the conversation. Really appreciate it. Thank you, Howard, for setting the stage about what it is. This is really important, critical work. If you want to continue to learn from peer states, please reach out to PDGB5. We'd be happy to connect you with other states doing similar work or help with the facilitation process of your prioritization piece. But I really appreciate everybody's support today and for joining and listening in. Thank you all to our presenters. Really appreciate it. Have a great afternoon, everyone.
Thanks, everyone.